Cassidy Curl, a 39-year-old single mom. Her family describes her as healthy, happy, and having more energy than most. She had no known health problems, unless you count trigeminal neuralgia. She took Botox for that. She also took birth control. She worked as a surgical tech for local plastic surgeons. She gets the Moderna COVID vaccine. Her first shot goes without incident, other than a sore arm. Second dose, not so much. She gets her second shot on February 1st, which is a Monday. Later that evening, she has a sore arm, nausea, and fever. That's not unheard of after someone gets the vaccine. Some people get a sore arm, fatigue, body aches, slight fever, and chills, especially after the second shot, and especially in younger people. Now, when this happens, people can take Tylenol or ibuprofen. No big deal, right? Unless they take too much. She did take Tylenol, aka acetaminophen, but we don't know how much. She felt a little better the next day, but by Wednesday, she's not able to pee despite drinking lots of fluids. She says it's the worst she ever felt. Thursday morning, 6 a.m., she tells her parents she needs to go to the hospital. In the ER, she immediately starts throwing up. Blood tests come back, and doctors say she was very, very sick and her liver was not functioning. Blood tests show that her liver is not working. This entails severe elevations of her AST and ALT enzymes. This also means an elevated INR. So what is going on here? This is acute liver failure, aka fulminant hepatic failure or fulminant hepatitis. The doctors give her IV fluids. They also give her a drug to counteract the effects of Tylenol on the liver. It's called NAC or N-acetylcysteine. But the damage was already done. Around this time, she becomes incoherent, and this is because acute liver failure causes the brain to swell, called cerebral edema. If it's severe enough, it can result in coma. At this point, her only chance of survival is with a liver transplant. So she was flown to a transplant hospital, but when the liver completely fails, it causes other organs to follow suit, especially the kidneys and brain, and soon after, the heart and the lungs. She's put on full life support, including a breathing tube. Even if there was a match for a new liver, she's too unstable to undergo that operation. She dies about 30 hours after she first arrived at the ER. She leaves behind a young daughter who wants people to hear her story. And if you want to contribute to her GoFundMe page, I'm putting a link below this video. A lot of people will conclude that the vaccine caused her death, but timing by itself does not prove causation. And a lot of people want to know, did the vaccine cause her death? And if not, then what caused it? A Utah medical examiner completed a full autopsy, but the results remain private. The medical examiner said the autopsy did not show a link between vaccine and death, which is hardly surprising. If a vaccine caused someone to die shortly after receiving it, how would it do so? The only medical explanation would be an immunological reaction, meaning an allergic reaction. So far, in the US, there have been over 200 million doses of the vaccine given. No one has died from a severe allergic reaction as a result of the COVID vaccine. And in her case, it's obvious that she did not have an allergic reaction. For example, there was not swelling in the face or the tongue or tightening of the throat. Deaths after COVID-19 vaccinations are reported to the Vaccine Adverse Event Reporting System. Between December 14th and middle of March, there have been over 109 million vaccine doses in that time frame in the United States. Now, of those, there have been less than 2,000 reports of death on the VAERS system, which is 0.0018%. A reported death in the VAERS system doesn't mean the vaccine caused it. If someone dies of a car accident on the way home after they get the vaccine, what was the cause of death? So the big question in Cassidy's case is, what caused her acute liver failure? In the US, acetaminophen accounts for 40% of cases. In 18% of cases, there is no identifiable cause. 13% are due to idiosyncratic drug reactions, meaning medications other than Tylenol. The general recommended dose for acetaminophen in healthy people is no more than 4 grams per day. Sometimes people end up taking more than they should. Sometimes it's intentional overdose, sometimes it's accidental overdose. Regardless, this accounts for almost half of the cases of acetaminophen-induced acute liver failure. Acetaminophen toxicity, it presents in 3 phases. The first phase involves nausea and vomiting in the first 24 hours. In the second phase, during hours 24 to 72, there's a dramatic rise in liver enzymes seen on the blood work. Elevated AST and ALT, and high AST to ALT ratio. During this phase, acetaminophen causes kidney damage as well. The third phase, hours 72 through 96, consists of encephalopathy. Here, the brain is not working right because it's swollen. There's confusion or lethargy. This often progresses to coma. There's usually jaundice at this point as well. The treatment for acetaminophen toxicity is a drug called N-acetylcysteine. NAC can be life-saving. The sooner it's given, the better the outcome. If it's given within 10 hours of ingestion, there's a 95% chance of survival. Acetaminophen levels can be checked in the blood work. Increased levels help make the diagnosis, but even if they're normal, it doesn't rule out the possibility of toxicity. Why? Because it's possible that the liver already metabolized the acetaminophen. In fact, it's not the actual acetaminophen that destroys the liver. Instead, it's one of its breakdown products. It's a metabolite called NAPQI, which turns the liver into mush. Here's a picture of what I'm talking about. This is liver necrosis. And this is what a healthy liver looks like. When you look at it underneath the microscope, this is what you get. NAPQI, it also damages the kidney, and when the kidneys aren't working, people stop peeing. This is why it's so important that people make sure they're not taking too much acetaminophen. This drug is often combined with other drugs, and toxic levels can sneak up on people. For example, over-the-counter cough medications, Percocet, Vicodin, they all have acetaminophen in them. Medicine is complex. It always comes down to risk versus benefit, whether that be Tylenol or other medications, the risks of the virus versus the vaccine. That's why it's important to stay in the know. Thanks for watching.